Joined on the Newsmaker line this morning, we have Therese Michels. Good morning, Therese. She's with St. Luke's Breast and Bone Health, and we appreciate you joining us on the program. It's breast cancer awareness time, and during the COVID-19 coronavirus, we've heard about it for a lot of different things, but you saw a downtick in the number of people who were coming in for their regular screenings, and you want to make sure that we reverse that course.
Absolutely. Yeah, people were scared to come out of their house, and it's still somewhat that way. But we always tell people that diseases and cancers, they don't take a break during COVID. They don't even recognize that it's going on. So to keep up all that preventative care is very important.
Yeah, it is. It is an important thing. What are some of the numbers that you're seeing as far as did you have an actual tick on the number of percentages that you were down as far as it went? And what are some of them, other than radio like this, what are some of the other ways you're doing outreach, Therese, in order to make sure you get women back in?
Well, with our reminder call or letters, we do have a little video that they can go on and see what the precautions that we're taking to get everything clean and disinfected. Our staff are always screened in the morning.
Exactly. I know. I definitely would imagine that. So as far as making sure, when you say St. Luke's Breast and Bone, tell me exactly. That's an unusual name.
It is.
Explain that to me, would you please?
Yeah, it is. For the bone part, we do bone density. And what that does is that screens to see how strong your bones are, so you can decipher whether you have osteopenia or osteoporosis. So that's a big thing, especially for women after postmenopausal, just to check that to make sure everything's good, because if you hear somebody older, falling and breaking a hip, that's usually due to that. So we also screen for that as well.
Okay, that makes sense. This is one of the things that we talk about in the morning show that, look, I'm 54. I'm starting to get to that age where physically I'm supposed to be making that transition from, middle age to just on the verge of senior. I'm eligible for AARP.
Yeah, I hear you.
What do people my age, men or women, what do we need to worry about with regard to bone density? What are some of the things that we need to be aware of? How can we tell that we're changing?
It's definitely in your genetics. If you see mom or dad, kind of having that humpback or losing height, that's kind of one of your first awarenesses too. And everybody loses height as they get older, unfortunately. But when you see a dramatic decrease, or if you start seeing yourself breaking bones that you usually didn't, kind of an increase in that area too. Those are the things to really look for. Make sure you take your calcium. Weight-bearing exercise is huge on that as well. So, that's another area that you need to be just very aware of.
Therese, what about supplements and things of that nature? I would imagine that there are a number of them out there, and the calcium has got to be very important. What are some of the other things that we need to be aware of as well?
It's multivitamins. Vitamin D is a good one. Calcium, anything with calcium or vitamin D mixed with it. But definitely consult with your physician first, because we want to make sure that you're on the right path with your medical history as well.
Yeah. Well, I know the milk, they have the vitamin D added to it, which is kind of a good thing, number one. And they do that, like if you're like me and you're lactose intolerant, they still have lactose-free milks that have the vitamin D, so you can still do it that way as well. When people call to make an appointment, well, first of all, can you get online to make an appointment? Do you have to call? What's the process for if I've got a listener right now saying, you know what, I need to get checked out. It has been too long and I need to go. What's the process?
Well, we have 3 campuses, so that's the wonderful thing about being in Cedar Rapids. If you don't like to go downtown, we have one on the west side and we have one on the Marion campus. So very convenient areas. You call 319-369-7216. Or if you're more of an online person, we do on our website, you can just click on request an appointment and just give them the days that work for you. We also have walk-ins for mammograms, for screening mammograms only, and that's from 9 to 3 at all 3 campuses. So we make it about as convenient as you can get it.
Okay. Insurance, the Medicare, all that stuff. What about individuals, because, maybe we know individuals who just don't have the financial means in order to take care of some of these things. Is there any way you can allay their fears?
Yeah, absolutely. If you have insurance that covers preventative, your screening mam's going to get covered.
Okay.
If you do not, we have other financial services that we run it through. Most people do qualify for it. It's a very kind of forgiving area with, the amount of people that make lower income salary. It doesn't have to be super low. We will run it through that process. And if you're approved through that, it's good through 2 years.
Gotcha. All right. Hey, last minute things you want people to know about St. Luke's Breast and Bone?
I'm kind of envious, but yeah, we have the best team in town.
Yeah.
So you won't be disappointed if you come in, and definitely get your screenings.
Yeah, do not avoid it anymore. Get over there. St. Luke's Breast and Bone, like she said, 3 locations around the Cedar Rapids Metro. Therese Michels, thanks for joining me here on the morning show. Appreciate your time and appreciate your dedication to your craft, okay?
You're welcome. Have a good day.
All right, you too. Take care.